Hello, in this video we will take you through some crucial information that can help save lives. First, we will address the opioid crisis, understanding what opioids are and why they pose such a significant threat to our communities. Next, you will learn how to recognize the signs of an opioid overdose, an essential skill for anyone who wants to be prepared in an emergency. Finally, we will go through steps on how to use Naloxone nasal spray, a life-saving medication that can reverse the effects of an opioid overdose, and guide you on how to place an individual in the recovery position after Naloxone has been administered.
So what are opioids? Opioids are a class of drug that includes synthetic opioids such as fentanyl, the illegal drug heroin, and prescribed medications such as oxycodone, hydrocodone, codeine, and morphine.
Opioids are often prescribed to treat pain, but they can be dangerous because they can be highly addictive and can cause overdoses. The use of opioids either by themselves or in combination with other drugs is a major contributor of the drug overdose crisis in the United States. Many recent overdose deaths involved illicitly manufactured fentanyl and other potent synthetic opioids, which may be added to other drugs and consumed unknowingly.
People consume fentanyl and other synthetic opioids both knowingly and unknowingly when these substances are mixed into or sold as other drugs like heroin, cocaine, or counterfeit pills. Fentanyl is about 50 to 100 times more potent than morphine.
Just 2 milligrams alone can be a lethal dose of fentanyl. Using a drug that has been contaminated with or replaced by fentanyl can greatly increase one's risk of an overdose. People can't see, smell, or taste fentanyl. That's why it's so important to be aware of what you're taking and to avoid any unknown substances. Even if something seems safe, it might not be. Counterfeit pills are like chocolate chip cookies. Some parts of the pill may contain fentanyl, while other parts may not. Fentanyl has been linked to more than half of all drug overdose deaths in the United States since 2019. Recognizing the signs of an overdose can save a life. Signs of an overdose may include small constricted pinpoint pupils, falling asleep or losing consciousness, slow, weak, or no breathing, choking or gurgling sounds, limp body, cold and/or clammy skin, discolored skin, especially in the lips and nails. It may be hard to tell if someone is having an overdose. If you are not sure, treat it like an overdose.
What is Naloxone? Naloxone is a life-saving medication used to reverse an opioid overdose. Naloxone can quickly restore normal breathing to a person if their breathing has slowed or stopped because of an opioid overdose.
There are 3 common naloxone medications. It can be given through a nasal spray, an injectable, or auto-injector into the outer thigh or another major muscle. For the purposes of this video, we will be focusing on the nasal spray. A common brand for naloxone nasal spray is Narcan. This is a needle-free device that requires no assembly and is sprayed into one nostril while a person lays on their back.
Naloxone should be given to anyone showing signs of an opioid overdose or when an overdose is suspected. It has no potential for abuse and is harmless if given to someone not experiencing an opioid overdose. It's better to be safe than sorry. Even if naloxone is successful in restoring a person's breathing, opioids are still in a person's system. It's crucial to seek expert medical care as soon as possible by calling 911. After administering naloxone, stay with the individual until emergency help arrives.
Now we are going to go over how to administer naloxone nasal spray when you suspect an opioid overdose. Step 1. Check for responsiveness. To begin, check if the person is responsive. You can do this by rubbing their sternum in the upper chest area, shouting their name loudly, or shaking their shoulders. Step 2. Prepare naloxone nasal spray. Next, remove 1 nasal spray from the kit. Hold the spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Step 3. Administer naloxone. Next, lay the person on their back on a flat surface. Tilt their head back and support their neck. Gently insert the tip of the nozzle into either nostril until your fingers touch the bottom of the nose. Press the plunger firmly to administer the full dose into their nose. Step 4. Call 911. Immediately call or have someone call 911 after administering the first dose. Stay with the person and monitor them closely. Follow all instructions given by the 911 operator. If the person does not respond to the naloxone and you are trained in CPR and feel comfortable doing it, you can also include this technique. The caller and the person administering naloxone are protected from any liabilities by California Good Samaritan laws. Step 5. Watch and repeat if needed. If the person remains unresponsive after 2 to 3 minutes, administer a second dose in the alternate nostril using the second nasal spray in your kit. Once the person begins breathing on their own, carefully place them in the recovery position.
The recovery position is crucial to prevent someone from suffocating or choking during an emergency. Before you place a person in the recovery position, you need to make sure the person is flat on the floor with no pillows around the head or face. If the person has thrown up, use their own fingers to remove any vomit from their mouth. Now let's go through the steps of placing someone in the recovery position. Step 1 is to kneel down beside the person. Place their arm nearest to you up near their head at a 90-degree angle as if they are waving. Step 2 is to grab the arm that is furthest from you and bring it across the person's chest and place the back of the hand against their cheek to guide and support their head when rolling them onto their side. Step 3 is to hold the person's hand against their cheek as you grab the knee furthest away from you and lift it up so their knee is bent and their foot is flat on the floor. Step 4 is to pull the knee that is furthest from you towards you so they roll over onto their side facing you. Then you will grab the bent leg and bring it forward and away from the body so it is resting on the floor. Finally, you will raise their chin and tilt their head back to open the airway.
People wake up from an overdose differently. It is important to keep them calm and explain what has happened. After receiving naloxone, a person may experience withdrawal symptoms which can include agitation, sweating, nausea and vomiting, muscle aches, runny nose, diarrhea, and/or anxiety. The effects of naloxone vary, lasting between 20 to 90 minutes. While these symptoms are uncomfortable, they are not life-threatening. It is important to call 911 to get the person the proper medical help. Reassure the person that help is on the way and that these symptoms will subside.
Carrying naloxone provides an extra layer of protection for those at a higher risk of overdose. Anyone, such as friends, family, and non-healthcare providers, can carry naloxone, administer it during an overdose, and potentially save a life. Naloxone is free and available to pick up at Alcove Beach cities. It is also available over the counter for purchase at most pharmacies and drugstores. If you or anyone you know needs help or support, don't hesitate to reach out to your primary healthcare provider or seek resources and support services available in your community. You are now equipped with the information you need to administer naloxone in the event of an emergency. Thank you for watching. Stay informed, stay prepared, and most importantly, stay safe. Together, we can make a difference in our communities.